Vision of FOGSI is reduction of maternal deaths in India and improving perinatal outcome. And this year my theme is completely centered around women's empowerment, which will help to reduce the maternal death rate. So in a nutshell, I want to just quickly tell you my theme: empower women, empower India. Because by empowering women, you will empower India, and pledge for excellence in whatever you do. So we have designed 4 very important workshops, particularly for helping the maternity care providers, which is the doctors, the nurses, the paramedical personnel, to help to reduce the maternal death rate. So one is postpartum hemorrhage, predict, prepare and handle, which has been organized by Dr. Sheila Mani. The second one is a standardized certificate course in the management of hypertensive disorders in pregnancy. Because as you know, the 3 major killers are hemorrhage, hypertension, that is blood pressure in pregnancy, eclampsia, and the third is sepsis. And the bottom underlying factor for all this is anemia. So an anemic woman becomes a prey to all the problems. We have formed a module with the help of core group of experts, and we will be training 40 to 50 doctors from all over the country. These 40 to 50 doctors are also experts in their own fields. So we will tell them exactly what we mean by the standardization, and they in turn will then start training doctors in their own respective areas. So by the end of the year, we expect majority of our FOGSians to be trained in the management of hypertension. We have workshops for empowering the women because it's important for them to be empowered. So we have workshops on family welfare, where helping her to choose the right contraception. These are again in the form of modules. Then we have a women empowerment program, where every society, we have given instructions that they felicitate women in their society, acknowledging that they have done something, and they do it in front of their society members, so that a woman feels, yes, I must also reach up to that particular stage. And then we discuss about, what you have to do to reach that particular position. How do you get successful? How do you tackle, your home problems? So that is again a social issue. For the medical college, we have another very interesting program, which is the FOGSI Medical College Initiative for reducing the burden of cervical cancer. What happens is, the first year medical students, physiotherapy students, nursing students or dental students are very busy getting their CETs and getting their courses. So once they get inside, all their admission formalities are over, that's the time we talk to them about, have you prevented yourself from cervical cancer, particularly the girls? And we discuss about how it's a totally preventable cancer if the vaccination is taken before the girl gets sexually active. So this is the message that we want to give. I think the collaborations are very essential, particularly when you're looking at common subjects. The whole idea of getting together is, one is giving a message that we are all working for the betterment of women and children. Second is, you have an expert group from both the sides, and they can deliver the goods much more better. So that's very important. And FOGSI is also an invited member for the government Ministry of Health meetings. So, we attend the expert group meetings. We have also worked with the NGOs like the Population Stabilization of India, PSI, Population Stabilization International. We are also working with the other organizations like Impact Foundation, like IPAS. So there are some 8 to 10 groups, FPAI, and Association of Fellow Gynaecologists. So we all work together so that we can get forth a better module. And there's unity in working together, strength in working together. And some of the NGOs, like the international NGOs like Japaigo, they've also worked with some of our workshops. So it's important that when we all work together, we will be able to do better. Logistically, it helps us, and if we have the government along with us, it really makes a lot of difference. See, in the last 5 years, we've seen that there has been a radical change. People have been more proactive. As I said, they do invite FOGSI for all their meetings, be it an MTP issues meeting or be it a PCP NDT meeting, because Save the Girl Child Initiative was a big issue, and FOGSI had joined hands with the Government of India in helping to get the sex ratios back to normal. So certainly we find that they are more proactive. We are more than willing to come forward with them, help them in formulating policies and even in implementation. One of the classic examples is the EMOC project, the Emergency Obstetric Care Project of the government, which FOGSI has been running very successfully for the last 10 years. And I hope all the viewers who are listening, if some of them are FOGSI members or they've got friends from FOGSI, I hope that they would look at our website, they will come forth, they will volunteer to work for whatever cause, like commitment to a cause, and at the same time they can ask their societies to, we have workshops which have been supported by educational grants. All my 18 workshops are supported, so it's just that they have to come, they have to ask for it, and we have a team ready to go and do the workshop for them, because that's going to help them to do better. Thank you so much.